Well, waiting patiently, which makes us change, I suppose, from everyone waiting patiently for him, is our dentist, Dr. Aman Bharti. Aman, thank you for waiting with us. Obviously, we wanted to reflect and will continue to do so, the passing of Jack Charlton. But back to our Saturday professional. So you work from the centre of Leeds. We've been talking about the fact that this has been a very bizarre time with dentistry disrupted for a long time. But you were saying you've been back in action for about a month now.
Yeah, that's right. I'd just like to say, first of all, obviously that was news to me, about Jack Charlton. What sad news. And I was listening on intently there. So, don't worry about that. That's amazing. Such sad news. But yeah, sorry, back to the professional. So, we've been open about a month now. Still, only working at about 75% capacity. But I was explaining before about how some practices still aren't able to get going yet because we have to wear a new level of protection with our masks. And they have to be officially fit tested. So lots of companies and practices are having difficulty sourcing masks, first of all, and actually getting them fit tested. So there's still many practices which aren't up and running yet.
So when you say sort of fit tested, so you need to wear protection that is more closely fitted, but also you need to be inspected to make sure you're doing everything properly. Do I understand correctly?
You need to be inspected to make sure that the mask fits properly. You can't legally wear this mask and work unless it's been fit tested by a trained fit tester. So it's something called a taste fit test, where a hood is put over your head while you're wearing the mask. They spray some bitter solution into the hood, and you shouldn't be able to taste anything bitter, because if you taste anything bitter, it means that the mask is leaking. So until dentists can actually be, and nurses as well, can be tested that their mask fits them properly, we can't get to work. It's a safety requirement.
And functionally, what is it like that? I mean, a lot of people are commenting on the fact I've had my hair cut, which frankly, I've lost about 20 years and about a stone in weight with the amount of hair that came off last Tuesday morning. But the fact is, Finn, who cut my hair, he was behind a visor. He couldn't cut my beard because he wasn't allowed to come around the front. He could only sort of do what he could reach around the side and the back. Clearly, with what you do, in our mouths, with the jets of water that you use, we're into a whole different league. But it must be very odd for you because you work close up to people. You need to be able to see, you need to be able to breathe, you need to be able to communicate with people. It adds quite a lot of complexity in, let's put it bluntly, Aman.
It does. It's very complex. I'll just explain the complexities. So, we have to wear these special masks, first of all, which are very tightly fitting. And actually, to be frank, they're quite suffocating as well. And then, the visor goes on top, and then usually we have to wear our magnification, so it's an extra bit of weight on your head. We have to wear these plastic aprons, because then it's just an extra layer to peel off after we've done an aerosol procedure. And then the biggest thing for dental practice, and the reason why a lot of businesses are actually struggling at the moment, is we have to have something called fallow time after we complete a procedure, which means that we literally just all leave the room, down the tools, and we have to leave that room empty for an hour to let all that aerosol settle before we can go in there and clean again.
A whole hour? But so hang on. So you just have to leave. And so if you're talking a surgery or a setup that doesn't have a lot of space, that's a real limiter, isn't it?
Absolutely that. And, this is why we're going to struggle for a period of time. I mean, we're blessed with space at Headrow Dental. So, we have multiple surgeries, so we can actually rotate the surgeries. But there's many clinics which don't have that luxury or that facility. So that's why a lot of practices still haven't opened, because they haven't figured out how to work this out yet. A lot of dentists haven't come back to work because they need the surgery space to be able to rotate like we're doing. So, that fallow time, that space between patients, it's detrimental for business, obviously, but it's something that we have to do because we're still not over the worst yet, I don't think. We are over the worst, but we're not out of the woods yet, I should say.
No, good way of putting it. Has our dental health suffered? Because there's been a talk about health in lots of other areas. I mean, for example, 13-year, I saw a headline yesterday, 13-year progress on waiting lists in the NHS generally, lost in the few months we've just been through. Concerns about people with cancer treatment going not happening, because if you're vulnerable, actually leaving home and all the rest of it might be tricky. People with mental health worries as well. What about the dental side of things? Have we taken steps back, or is it all rescuable, do you think, Aman?
I think inevitably there are going to be some people, unfortunately, who have really suffered throughout this pandemic, and they weren't able to access care. And there's been many stories which I've read where as you said at the beginning, people trying to pull out their own teeth, just suffering with toothache for days and days and days. I mean, we're very fortunate at Headrow because we've got obviously a smaller patient base with us being an independent clinic. So we were able to offer our patients care, but there's a lot of people out there who couldn't access care. So yeah, it has been a little bit of a backward step for some people. As far as waiting lists go, well, still a lot of practices aren't open. So yeah, there's still a lot of people which can't access care. So it is difficult for a lot of people, but I think we're over the worst of it. So I think things will start to get better. I mean, you mentioned cancer referrals as well. That did pause for a very short period of time, but that did very, very quickly, even during the pandemic and during the lockdown, still continues to run for emergency patients and cancer referrals. So that didn't suffer, but it's the routine care that suffered.
Well, I had my routine checkup and my hygiene visit cancelled, but Thomas, my dentist, if you're listening, I have been flossing religiously twice a day, so I think we should be all right. Aman, I'm sorry we were interrupted. It's been very nice to speak to you, but thanks for your time and stay healthy. Really appreciate you being our Saturday Professional this week.
It's a pleasure. Thank you.
Thank you. Dr. Aman Bharti, dentist from Headrow Dental in Leeds, and that is your Saturday Professional.